Hi everyone and welcome back to GP Notebook TV. Lisa Devine is my name and I am a GP in Wicklow in the Republic of Ireland, and I'm really delighted to be here with you today to share with you a short video on a really interesting recent article from the BMJ. So when I saw this article coming up in the BMJ about an intervention aimed at patients with long COVID, well, I had to stop and take a read. This article is called, a little bit of a mouthful, Clinical Effectiveness of an Online Supervised Group Physical and Mental Health Rehabilitation Programme for Adults with Post-COVID-19 Condition, called the REGAIN Study, a multi-centre randomised control trial. So a little bit of a mouthful, but a randomised control trial published in the BMJ in 2024. So let's have a little look. So we know that COVID-19 was very common, and the World Health Organization estimated that in the European region, in the first 2 years of the pandemic, there was more than 17 million that might have experienced COVID-19 side effects lasting more than 4 weeks. So one of the definitions of long COVID. Many of the disabling symptoms that people get with long COVID include fatigue, shortness of breath, muscle ache, and as we spoke about, those mood-related and cognitive side effects. The REGAIN study was really looking at an intervention to see if there was something that could be done for people with ongoing sequelae of long COVID. So what was it? It was a trial that was carried out to evaluate whether a supervised, online, structured group programme, which focused in on physical and mental health rehabilitation, could improve the quality of life of people suffering with long COVID. It was a multi-centre trial which took place in England and Wales, and the study design, as we were saying, was a randomised control trial. Now, it took place across different centres which all signed up to deliver the same intervention, and they enrolled 585 adults. Those 585 adults ranged in age from 26 to 86, and they had to have been discharged from an NHS hospital with COVID-19. So a cohort of patients which had COVID-19 that was severe enough to hospitalise them. The control group received usual best practice care, which consisted of a single online session of advice and support from a trained practitioner, and the intervention group got the REGAIN intervention. So the REGAIN intervention was a new kind of an intervention, and the study designers based this off a rapid review of existing literature on rehabilitation, and they looked at sources such as rehabilitation programs for COPD or chronic fatigue syndrome, or people affected by the 2003 SARS epidemic. The people who were delivering the intervention were exercise physiologists or physiotherapists trained in the REGAIN intervention, and they were supported by health psychologists. Most of the trial was delivered through English. However, there was a non-English speaking pathway which was developed, and the trial materials were delivered in English but translated into the 5 most common other languages spoken in England. So from the patient point of view, what was the REGAIN intervention? Well, there was an exercise arm and a psychological arm. And for the patient, the REGAIN intervention started with a one-to-one session with a REGAIN practitioner, which was a 1-hour session where the patient got to talk about their experience of COVID-19, their hospitalisation, the symptoms that they still had after COVID-19, and how they felt they could be supported best through the REGAIN intervention. At that point, they were then enrolled into the group aspect of the intervention, which was an 8-week-long rehabilitation programme which consisted of structured online sessions. There were 2 types of online sessions delivered, one related to exercise and one related to psychological support. The exercise sessions were all equipment-free, they were delivered at home, and they were delivered in groups, and they were delivered under the supervision of one of the REGAIN practitioners. And they aim to improve cardiovascular fitness, strength, balance and fatigue, and support people to feel more confident in continuing on with their activities of daily living. The psychological sessions were semi-structured and facilitated by the REGAIN support workers again, and they looked at people's experiences following COVID-19, and then they looked at different strategies that could be used to improve symptoms. So they looked at things like motivation, fear avoidance, activity pacing, managing emotions and setbacks, improving sleep and fatigue, management of stress and anxiety. So really good, I suppose, really good holistic kind of a program. At the end of this, an online on-demand library of different exercise and physical activity videos were made available to the participants. So what did they look to measure? So what results were they looking for? Well, they wanted to measure health-related quality of life outcomes. And they did this by getting participants to fill in a questionnaire called the PROMISE questionnaire at 3 months, 6 months and 12 months. And the PROMISE questionnaire looked at things like depression, fatigue, sleep disturbance, pain, physical function, daily activities and cognitive function. The results were really interesting. So as we said, they enrolled 585 adults in the trial. The mean age of the adults was 56, but they ranged in age between 26 and 86. They were 52% female and 48% male. We did talk about these being patients who were relatively sick with COVID-19, so they had to be hospitalised in order to be eligible for the trial. And interestingly, 34% of the patients had been in either ICU or HDU with COVID. 298 patients received the regain intervention, and usual care was provided in 287, which was that one session. So pros and cons that turned up in the results. So overall, the results seem to be really positive. So at 3 months, health-related quality of life improved for many more patients in the intervention group than the usual care group, and improvements were seen in fatigue, depression, and pain in particular. These improvements were seen less at the 6-month mark, but interestingly enough, were seen again at the 12-month mark. Overall, the intervention was relatively well tolerated. There was one serious adverse event in the regain arm, which was a syncope with vomiting within 24 hours of an exercise session. And there were 2 less severe adverse events that were related to the regain intervention. So one was unilateral knee pain during an exercise session, and the second was a person experiencing severe anxiety before going onto one of the group sessions. But overall, it was quite a well tolerated intervention. And even though it was quite an intensive intervention for the patients to commit to, the adherence was pretty good. So 47% of the patients fully adhered with all of the sessions in regain, and 39% partially adhered, and only 13% really didn't adhere with the intervention. It was interesting to see that over time the scores did improve in both groups, both the regain group and the usual care group, and I suppose that reflects the fact that hopefully over time symptoms of long COVID do improve, but it was very clear that there was a higher rate of improvement in the regain group. So really interesting study, certainly I think gives us good food for thought, and it gives encouragement for further looking into more of these holistic programs for patients. I really enjoyed reading the article, and I hope you've really enjoyed watching the video, and I look forward to seeing you again on GP Notebook TV.